The high velocity thrust with no amplitude is for the posterior rotation dysfunction of the ilium. Is where the patient is laying on her side, on her dysfunction side up from the table, so it's here in this direction, and she's laying just in the middle of the table. I find the SI joint with my right hand and flex her to max, and can do it with my knee here. So just go up until I can feel that there is a slightly movement on the SI joint. Then I switch my hand, so I feel with my left hand. I take the top of the hand, the patient's right hand, and put it on the thorax, and take left hand and put it into my axial here, and hold on her arm. And then I make a small pull until I can feel that something happens in her SI joint. For the first, I take her into a flexion there, and a rotation, and an extension, and I can leave her leg here, so like that. Just I can feel what happens in the SI joint. It's okay. Then you flex your hand, so she locks herself. I go into the area here and feel with my right hand again on the SI joint, and I make again maximum flexion and ask the patient to stretch her lowest leg. We put in here her leg, and then I have to find the barrier from below, and I do it by making flexion on the hip on the lowest leg there. If we have a hypermobility, we maybe have to put the patient about nearly 45 degrees or so. On that place, I just pull a little bit down on the patient because I have to use my arm again, so it's skin on skin. And it must not be on the crista or on the area for performance, so just between. Then I want that the ilium should move forward, so I do it by I pull her out to me, and then I lock her with my own chest here, put my arm in supination and skin on skin, and I feel the barrier is right here. So the patient make a deep breath, I go back, let her breathe, and make a body rock.